My name is Florian Kretz. I'm the CEO of Augenärzte Girl Kretz & Colleagues in Northwest Germany. We have 9 facilities in total and 4 surgical centers, and we perform around 7,000 to 8,000 cataract surgeries per year. I mainly work as a lead surgeon in the Augentagesklinik in Rheine and Graven, and we have many difficult cases coming all over Germany to us, especially with like Marfan syndrome and also like juvenile cataracts for treatment. Well, I think the most important part about micro instruments is actually that you have them available as disposables now, because you don't use them all the time. So often if you don't use an instrument for a long time, it can be that it won't work anymore. And if you have like single-use instruments now, it's very handy because they're always fresh. You can get them replaced. You don't have the problems with the sterilization that actually is getting more and more cost intensive. The other thing is the usability of those instruments needs to be still very simple and very clear, and the materials need to be of a good quality. That's the main reason why we like working with MST, because we actually get that quality and we know what we open will work the way it's supposed to. Well, we lately just had some cases of Marfan syndrome. So in those patients often like the whole lens is dislocated. And the other problem is that like the capsular bag is actually, it's not that strong. So it's like flopping around during the surgery. So it's very handy because you can perform a small capsular access with a microforceps that is exchangeable. And you can actually like hook up the capsule with one of our capsule retractors and pull it to the middle. So you can actually perform a completely normal phaco with just holding the bag in place. And once the lens is out, then you can actually decide, can I reuse my capsule or do I need to find a different option for the fixation of the lens? If we do a scleral fixation, we use the imame technique now. So often we need to use the microforceps just to like bring the haptics into the needle and pull them out. So it's very practical, and because those things are exchangeable and you have so many different instruments for you, it makes it very simple in the OR to improvise in such cases. Oh, I think especially in those cases where you have a dislocated lens, you basically always need to be prepared that you kind of have to perform a secondary implantation. If you feel comfortable, you do a retrocapillary iris fixation, but you can also do a scleral fixation, and the techniques with the glowing handshake techniques, they're very simple. But the problem is you realize your difficulties at the moment they happen. So it's always good you have like all those instruments that you need in front of you. The problem is if you have like a re-sterilized big set of instruments, you always have a very expensive sterilization process, and they get damaged over time from the sterilization, even you don't use them. So it's much easier if you know you have your handpieces there that you need for the connectors, and then you have your single-use instruments that just can be opened at the moment you need them. It's more cost effective, and it really helps you because you're prepared for every situation that can come. Surgery is getting smaller and smaller. We perform surgeries earlier on our patients as well. So there is a percentage that is increasing that do get problems due to pseudoexfoliation where the zonule doesn't fit, and those are becoming more and more patients. And I think that's like the main field of the micro instruments, that they have a great availability, that you can like really use them for IOL exchanges in complicated cases. But they're much simpler to use, and we don't have the sets where you have like 50 instruments anymore. You have like your 2 hand pieces that you need, and the rest you can have in single use. It just makes it far more handy, better storage, cheaper costs, and that also gives more surgeons the possibility to actually work with those instruments and start treating complicated cases as well.